Judy and Carol. What are we doing tomorrow? I have that sense as well. You okay? I'm going to have you back through that. Make a general comment. You also going to do it? And the grants?
The grants.
Okay.
Yes. Yep.
Oh, yeah.
Here,
Whenever you're ready.
Thank you. Very good. Well, good morning, everybody. My name is Jim Cooney. I'm the CEO for OSHA Mental Health Services, and I especially want to welcome everybody here. Especially want to welcome our governor, Governor Murphy. It's
Thank you,
really a
sir.
pleasure and an honor to have you here at OSHA Mental Health Services.
Thank you,
I
Chair.
also would like to extend an invitation and welcome to Commissioner Johnson. Carol, it's wonderful to see you here at OSHA Mental Health. A lot of the work we do is in coordination with your department, so thank you for being here today. I want to welcome everybody else here today as well. OSHA Mental Health Services celebrated its 60th anniversary last October. We run 45 programs. Many of them now are addiction services programs. And those addiction services programs got a big boost a year and a half ago when we became a certified community behavioral health care center as designated by SAMHSA in the federal government. So we were really proud of that. We became the 50th CCBHC in the country when we were so designated. So we've been gearing up many more programs, especially to do with addiction services. This is a new site for us here at OSHA Mental Health. And a lot of our addiction services programs are here at this site. You should know, Governor. In particular, we have our intensive outpatient program, or IOP programs here, and we're hoping to get going very soon. Or we're waiting for a long time for a license from the state. Maybe you can help us with that at some point.
Who's running the state?
But we're scheduled to have a withdrawal management program here, an ambulatory withdrawal management. It's a wonderful program that syncs very well with the IOP program. So hopefully that'll get going very, very soon. So, okay.
That's where you.
I'm taking notes.
Thank you, Judy. Let's talk later, okay? We've only been waiting 14 months, Judy. So, and by the way, it's a program that has all federal dollars and not a dime of state money in it. And we're just sitting on the sidelines right now waiting. So, in any event, we're really thrilled to have you here. It's an important issue that we're discussing today. So I want to thank you for being here. And
Thank you, Jim.
Okay, and I think Mayor Amato, it's also a thrill to have you here at OSHA Mental Health, but you've been here before, so.
I have. Thank you very much, Jim. It's an honor. Welcome, everybody, to Berkeley Township. It is an honor and a privilege to hear as we host the governor. Governor, thank you very much.
Thank you, Mayor.
For being here. Very good discussion going to be happening today. I want to thank all the commissioners here to be here as well. And it's my honor to introduce some of the electeds that are here. We have Senator Sam Thompson. Thank you, Senator, for being here. Assemblyman John Armato. We have our Ocean County Freeholder Gary Quinn is here with us. We have Ben Giovanni from Congressman Andy Kim's office. Thank you, Ben. And then last but certainly not least, we have our Ocean County Prosecutor, Brad Billheimer. Thank you, Mr. Prosecutor. Governor, thank you again.
Thank you, Mayor. I think we're going to hear from Lauren Rader. Is that right, Lauren? I think you're up.
Thank you very much.
God bless you, and thank you. Do you mind pulling that microphone a little bit closer to you?
Sure, no problem.
And we'll go around, and after a couple of folks speak here, we'll do a quick introduction in a couple of minutes. John, we'll start with you, and everybody can go around and say who they are. Lauren, welcome.
Thank you very much. Is this okay?
Yeah,
All
we're
right.
good.
Thank you so much for having me. It's such an honor to be a part of this. So I'm a little nervous. Please forgive me for
No
that. My name is Lauren, and I'm a person in recovery. That's how I like to start every story. When I was asked about my story, I sort of picture this vast mosaic of pain and joy and beauty and suffering. I imagine to reach the whole center of that story, I have to talk about the trauma too. Having experienced some sort of trauma in one's life is almost always consistent with subsequent substance abuse disorders. I've had many significant traumas. Throughout my life, I came to realize that my self-destructive patterns are a direct result of corrupted core values and negative self-perception from an early childhood. I have suffered from depression and anxiety disorders my entire life, with periods of depression at times so intense and crippling that I've contemplated and attempted suicide on several occasions. I was married at the age of 22, and 2 years later welcomed a beautiful baby girl into the world, and my life was forever changed, so I thought. This gorgeous little life changed everything about how I viewed myself and how I perceived the world around me. My most significant personal value today is to be the best mother to her as possible. During an ugly divorce proceeding years later, I fought to maintain custodial rights and succeeded in doing so, maintaining my position as my daughter's only consistent caregiver, something I hold very high in regard. Passionately, fiercely, that's my priority. But I lost sight of this years later because of my disease, because of addiction. On September 14th, 2018, I woke up to find that my boyfriend had committed suicide. He was under the influence at the time. The reality of experiencing something as traumatic as that is that the eventuality of the effects of PTSD, panic attacks, and flashbacks have a direct effect on that disease, you know. So I started using opiates almost immediately after his death. February 13th, 2019, I was driving home to Ocean County from Camden County. I totaled my car, causing a 4-car accident while I was under the influence of opiates. After I was released from Burlington County Jail, I was visited 2 days later by the Division of Child Protection and Permanency, and they temporarily removed my daughter from my custody. I've never had to see her being supervised. It was a very tough consequence, devastating, and an absolute affirmation that I had strayed so far from my values and allowed my darkness to become my pilot. So I placed my daughter at risk and didn't deserve the right I had fought so hard for in my divorce. The division and the Burlington County Court strongly stressed that without a treatment program and proof that I was willing to seek help and create real change, that those criminal charges I had amassed from the accident would not be considered for alternative rehabilitation efforts, and that I would never have custody of or access to my child as I had before. So the choice was pretty clear. But truth be told, I had been screaming inside for years and years for help with the pain that I carried. So I enrolled in the intensive outpatient treatment program at Ocean Mental Health, a decision that has impacted my life in unthinkable ways and opened doors beyond my wildest expectations. I'm gonna cry. The one-on-one counseling I received allowed me to really explore the things I needed to consider and taught me ways to manage my anxiety and work through the process of experiencing emotions. Drugs had kept me stagnant and frozen in a place and unable to move past any of my trauma. Group therapy, honest discussions, cognitive behavioral exercises, and open conversation really expanded my mind and allowed me to be honest with myself and others. I was treated not only for my substance abuse disorder here at Ocean Mental Health, but also for my mental health issues, which I think is so important to treat co-occurringly. I began attending AA outside of IOP, filling my free time with recovery-based outlets and surrounding myself in daily practices of positive affirmations, the utilization of creative outlets, meditation, and connectivity with my recovery community. These are all things that I learned here. At Ocean Mental Health, I attended every session of the entire program and opted to stay on for additional counseling services upon graduation, always knowing that I would leave with some invaluable resource or lesson that would further foster my recovery. Ocean Mental Health provided an opportunity for clients to receive assistance from peer recovery coaches, which turned out to be another amazing door that would later open for me. This coach connected me with an organization called Hope Sheds Light, a nonprofit agency which raises awareness and educates about the impacts of addiction. This agency offers an array of recovery resources and is active in the Ocean County community. I began volunteering for their events and meetings immediately upon graduating from IOP at Ocean Mental Health, and months later I worked hard to obtain a recovery coach certification through this agency. I was also motivated to re-enroll in college to finish my degree, which I will in November, God willing.
All right.
Ocean Mental, thank you. Ocean Mental Health gifted me with the opportunity of working as a recovery coach for the very organization I believe in so much, an honor I cherish and value every day. So I get to work in the place that helped me, which is fantastic. I participate in refuge recovery meetings at Hope Sheds Light. I attend AA. I work several crisis helpline shifts for Hope Sheds Light per week, continue to receive counseling at Ocean Mental Health, volunteer as a recovery coach at Hope Sheds Light, and do so many more things. Above all else, the services and assistance I received throughout this journey gave me the tools I needed to regain my position as the best mother I could be for my child. I have regained custody once more, and I'm able to set a healthy example for her, something really sustainable. While I still have difficult moments and even days, I have such an expansive network of resources now and a recovery community who I can really lean on to support me through this process. And for once in my life, I am proud to be myself.
All right, Lauren. What extraordinary courage. How old is your daughter?
She's 8 years old.
God bless that gal. What's her name?
Her name is Scarlett.
Scarlett. Let's hear it for Scarlett. God bless you.
Thank you so much.
Great job, and great to have you with us.
Thank you.
My guess is we'll hear from you again before we break, but it's an honor to be with you.
Thank you so much for letting me share.
It's incredible. Thank you for the courage to share. I want to turn to my right. Andy, nice to have you with us. We have Andy Lesko here, who's a Pathways to Recovery participant, and it's an honor to have you. We'll move the microphone a little bit closer to you there. Thank you, Andy.
Thank you. Thank you for having me. I'm kind of nervous.
Don't worry about that. We all are.
So I guess I'm just going to tell you a little bit about my story, and then I'll read this. Today I actually celebrate a year and a month clean. I've been battling substance abuse. Basically, I started using anything around 5 years old. I remember I was abused for 10 years, from 5 to 15. So, I mean, I remember, taking Benadryl and just, anything to get out of myself at such a young age. And basically, when the abuse stopped, because I didn't want anybody to know what was going on, I hid everything. I turned to drugs and alcohol, and I thought the world owed me. The law, I broke the law, I thought, no one protected me there. I thought my family, owed me. I did a lot of things that weren't myself, I was going to school for criminal justice, I wanted, I wanted to be a cop. I wanted to save people who, I thought should have saved me at the time. So I started using anything. My drug of choice is heroin. I've been Narcaned 33 times. That doesn't include the overdoses. I mean, overdosed probably 60 times, but I have been Narcaned 33 times. My parents found me overdosed. My daughter found me overdosed. I gave my mom residential custody of my daughter when I started, after I had her, and I relapsed and I started using, which I actually just got unsupervised visits and my rights back just last month. So I'm happy about that. It's been very hard, and I'm in very early, still recovery, so doing things hasn't been easy, like employment. I'll get into that, I guess, a little bit after, but my struggles, have not been easy. Been discriminated, I got fired from several jobs because they found out I was an addict. I was being promoted, and they fired me because of medicine I was on to help my addiction. And as an addict, in early recovery, and it was just, a fast food place. If I can't get a job there, then you start thinking, there's not a lot of good, it's hard to get into those resources, an addict just doesn't want to sit there and, like, you know, show up to IOP. You know, you don't want to just go do those things in the
Sure.
beginning, like, but you like force yourself, and you know, you start learning another way to live. And I started going to preferred behavioral health. My dad killed himself in 2016, so after that, I basically, that's where a lot of my overdoses came from. I tried killing myself several times, never worked. I
Thank God.
took my car and I overdosed while driving and crashing my car into a telephone pole doing 70 miles an hour. So I got a DWI. I just got my license back 3 days ago. I went to Preferred. I had to go for IDRC, and you know, at the time, at first, like, I liked it because I was starting to get depressed. Like, you know, I had people to talk to, and you know, it was good, like, being able to actually go and, you know, pass the drug test. Like, I don't know how long, like, you know, that took forever, but they helped me, and they gave me a program, Pathways to Success, and I went there. Not gonna lie, like, at first I thought, you know, come on, they're not gonna really help me, but they did. They helped me find several jobs. Some of them, you know, weren't for me, but finally I have employment, and they're still in my life. They taught me to find trust in people again. They provide me peer support. I could be very stubborn sometimes, and my depression gets to me, and I won't answer them, you know. And if I don't answer them after 5 days, they'll threaten that they'll call someone to see if I'm okay, you know. But they talked to me about everything. They came with me to my custody hearing for my daughter. You know, they've been amazing. They have showed me programs like that I didn't even know exist, you know, to help me. I'm a single mom. You know, eventually I plan on getting my daughter back fully, but right now I'm getting on my feet. I'm barely getting by. And, you know, they're showing me different programs, you know, to help me with even my bills, my career. Like, I would like to become, like, a peer recovery specialist. I would like to give back what, you know, was given to me and help other addicts. Like, that's, you know, my goal. But, yeah, they've just been, like, amazing. Like, I without them, I think I might have, there's been some times, like, I think I might have actually, like, gave up, you know, because I was just going for job and job. No one would hire me because of my background. Nobody. And, you know, it sucks. Sorry, it does. It's very hard. And, you know, it getting beaten down, like, for doing when you think you're doing so good, it's like people just judge you. And I really wish, like, you know, people could really look past and, like, not discriminate, because, like, we are good people, but we make mistakes, and, you know, I made a lot of them, and, you know, I'm here today, and I would have never done this at all, but I said yes because Pathways, you know, they helped me, and I wanted to give back to them, so that's why I'm here.
Thank you, Andy. Wow. Andy, what's your daughter's name?
Rayleigh?
Rayleigh?
Yeah,
And how old is she?
she's 7.
All right. Does she know Scarlett? Thank you both to Lauren and Andy for, one more time, extraordinary courage. There's nothing, I'm sitting here thinking there's nothing we can say that will come close to the gravity of what the two of you have just said. So I want to thank Jim and the whole team here at Ocean Mental Health Services. Thank you for hosting us for this discussion. It's an incredibly impressive facility, and you do great work, so thank you. Miramato, thank you for hosting us here as well. Deep appreciation. And to all the elected officials, thank you for being out here. I might add, importantly, for both sides of the aisle, and that's a statement, I think, that speaks volumes about this challenge, the road that we're on, whether it's here in Ocean County or around any of the other 20 counties in the state. We're all in this together, and we have to figure this out together. We already had a tip of the hat to both Sam and John, but I wonder, John, if you could just quickly again reiterate, just let's go spin around the table and everybody say who they are, if that's okay.
My name is John Romano. I'm Assembly from LD2, which is all of Atlantic County. I want to thank the governor for inviting me, number one, and your organization. This is very, very important to me. I have skin in the game. I have a 49-year-old son who is 3 years good right now.
All right.
So, I belong to the Atlantic County Drug Task Force. Jake Tack doing together Atlantic County. I'm a certified recovery coach. I run an organization for codependents. And I think like everyone else here, we do this to give back. I'm lucky. He's alive. So
Thank God.
that's what we do. Thank you.
Thank you, John. And John and I spent a lot of time on this topic going back and forth, and it's an honor to have you here today. Thank you. Katie, 2 days in a row.
Yeah. My name is Katie Storr. I'm the Deputy Commissioner for Operations at the Department of Children and Families. We operate the Child Protection System. We operate a lot of prevention programming, including keeping families together, and we're proud to partner with you on that program.
Thank you.
I see discomfort among our team. Do you want us to be using the microphones?
Yes.
Yes, please. Marcus, can you, or you can use this one either way. Yeah.
Good morning, everyone.
Is that on?
Yeah, no, it's for the press.
Okay, sorry.
Good morning, everyone. I'm Marcus Hicks. I'm the Commissioner of the Department of Corrections, and I'm privileged to be here to talk about how the Department of Corrections is partnering with our sister agencies to fight this epidemic.
Thanks, Marcus.
Good morning. My name is Kim Veith, and I'm the Director of Adult Clinical Services here at Ocean Mental Health. I've been here for the better part of 22 years and have worked both in children's services as well as adults.
Kim, great to have you. We've heard from Lauren. Why don't you keep that one down there?
Yeah, bring it back.
Judy?
Hi, I'm Judy Persicilli, the Commissioner of Health. Our goal in health is to prevent harm and to give care.
That's pretty straightforward. Carol?
I'm Carol Johnson. I'm the Commissioner of the Department of Human Services. In Human Services, we run the state's Medicaid program, which provides health insurance coverage, including mental health and addiction services, to 1.7 million people in our state. And we run the state's Mental Health and Addiction Agency, and we're delighted to be here, Jim. And Kim, thank you for the work that you do.
Thank you, Carol. Andy, we've heard from Mayor. You're good. Rob?
Rob Sarangelo, Commissioner of Labor. I'm just so wowed by Andy and Lauren's stories. And I'm proud that our department has helped fund the Pathways program that Andy talked about through Ocean County and 6 other counties. So we're looking to expand. It's been very successful about talking about to employers, helping folks in recovery find success in the workplace. We've known for a long time that a job and the dignity that comes with it is a very important social determinant of health, not just for the individual. So I think anybody in recovery, it's always a leg up when they have a stable job. And I'm really, as the son of a CASA volunteer, I love hearing that stability is helping both of you reunite with your families and your daughters. I think it's great.
Thank you. Thanks. Good to have you.
Hi, I'm Sharon Joyce. I'm the Director of New Jersey Cares, an office within the Attorney General's office to coordinate things within the department and to work with partners in other agencies to find those places where we can also help.
Thank you, Sharon.
I'm Senator Sam Thompson, 12th Legislative District, parts of Middlesex, Monmouth, Ocean, and Burlington counties. I do have a fairly extensive public health background. I spent 22 years with the State Health Department laboratories. We went through Legionnaire's disease, swine and flu disease, numerous disorders and so on. I also served for 10 years on the U.S. Armed Forces Epidemiological Board. We'd meet at Walter Reed or some military facility every 3 months to discuss all the health and occupational hazards facing our armed forces throughout the world. I did have the Narcotics Monitoring Service as well, in which we worked with drug treatment programs to help assure that the individuals were staying clean in the process.
God bless you. Thank you, Sam.
Hi, I'm Dr. John Coolin, and I'm going to say I'm probably the least likely person to be here today in the grand scheme of all these esteemed people. But I think mostly I'm here because of some innovative programs. I'm CEO of Urgent Care Now. We have urgent care centers throughout Ocean County, and we've partnered with Ocean Mental Health. I've had the honor of meeting Commissioner Johnson and her team. and trying to find ways to, because what I'll say, our mission at Urgent Care now is providing access to care. And one of the things we realized over the past few years is that there wasn't good access 7 days a week to behavioral health care, including substance use disorder. And so that's one of the things we focused on over the past year and a half, is really including substance use disorder, including depression screenings for every urgent care patient who comes in our facilities, as well as we have about half of our providers currently have their MAT certificates, so we're able to provide Suboxone. And we're doing that 7 days a week, and then working in conjunction and getting people to care with Ocean Mental Health and other services for the intensive outpatient therapy and everything else. So I think that's my main purpose here, and I look forward to hearing from everyone else too. Thank you.
Doc, thank you for being here. I'm going to go off script on two topics that are unrelated to why we're here today, but I want to make sure I deal with them. First of all, I don't know where there was more frustration, lack of communication, or more confusion last night. The Iowa caucuses or New York Penn Station. The Iowa caucuses are above my pay grade, but the experience that NJ Transit commuters had last night was completely and utterly 1,000% unacceptable. I believe it was Amtrak's fault, but the lack of proactive, aggressive communication on behalf of NJ Transit is unacceptable. If folks are frustrated and angry, I don't blame them, and so am I. I want to separately speak to the global coronavirus outbreak that continues to dominate world headlines. Yesterday, I established a state coronavirus task force to coordinate all state preparedness efforts, bless you, and work with the federal government. I assume that was not timed to this discussion. And Newark Liberty International Airport to ensure effective communications as this evolving public health challenge continues to unfold. The task force is chaired by the woman to my left, Health Commissioner Judith Persicelli, and includes the Department of Human Services, represented by Carol, Law and Public Safety, Education, and the New Jersey State Police in the Office of Homeland Security and Preparedness. We are continuing our partnership with officials, not surprisingly, at the Port Authority of New York and New Jersey, as flights from China are rerouted into Newark Liberty International Airport, where protocols for the screening and handling of passengers have been established in accordance with the CDC. This includes a mandatory quarantine period for passengers who have traveled in affected areas of China over the past 14 days. The process at Newark Liberty is already in effect and underway. Several flights originating from China, and Judy will correct me if I'm wrong, a total of 350 passengers were screened last night. 16 were put into secondary, and no passengers required further action. We expect more flights to land today, and we are prepared. Let me be very clear, there are neither any confirmed cases nor persons under investigation in New Jersey at this time. We have created this task force of experts to ensure cross-agency collaboration to protect the health and safety of all New Jerseyans. New Jersey continues to work closely with the CDC and our local health partners. For anyone with concerns or questions, information is available 24 hours a day, I believe, by calling 1-800-222-1222. That's 1-800-222-1222, or by visiting nj.gov/health, nj.gov/health. And as Judy has noted, everyone can be a part of the solution by doing simple and common sense things like washing your hands with soap, preferably for 20 seconds, as my late mother would remind us frequently, and if you're sick, please stay home. So thank you for allowing me to get that out there. Again, I want to reiterate my thanks to everybody, our hosts, the mayor, the electeds, the providers, the medical and healthcare professionals, and most importantly, Lauren and Andy for their courage here today and to be with us. We just received data, so I don't view any of this as reason to do any celebration, right? So last year, we estimate that there were 2,031 deaths related to opioids in the state of New Jersey. The only modest morsel of good news is that that was a reduction from 2018, a slight reduction, a low single-digit percentage reduction, but that was after, I think, 3 consecutive double-digit percent increase years. So that gives you some sense that maybe we're beginning to bend the curve. We just got the January data, which again, not only gives us no reason to cause to celebrate, but I think it continues to be quite concerning. So it is a decrease from the amount of deaths in December, which is fine, but it's still 280 people lost their lives last month due to this scourge. And that, concerningly, is up from 203 people in January of last year. Now, I'm not sure there's an apt seasonal to seasonal, month-to-month comparison like you would in some other situations, but needless to say, we are far, far, far from the goal line. We have in place, as we've said before, basically a four-pronged approach to this. Number one, we're data-driven, Moneyball-driven. Number one is to make sure we get the data and we know exactly what's happening, why it's happening, and the extent to which we need to change course correction. That data informs us of that. Secondly, treatment-specific programs. MAT was mentioned by John, and other programs. I'm going to turn it to Carol in a second to give you some specifics on that. Thirdly, as Rob and Andy discussed, the sort of social determinants of health, the broader stuff, like jobs, like housing. So that's the third prong. And then fourthly is law enforcement. And that includes the whole range. Brad knows this well, from breaking the backs of the drug mills all the way to taking the opioid manufacturers and distributors to task. So those are the four prongs of our program. Again, we think this is the direction we need to be headed, but we still have 280 lives lost. Last month is 280 lives, precious lives, too many. So we are far from the finish line. I know that Carol, to my right, who's done an extraordinary job on this front, has a number of things to tell us about, including some community grants that are hot off the presses, as well as relaunching some public awareness programs and the re-upping the Narcan steps that we took last year. So with that, I'm going to turn it to our Commissioner of the Department of Human Services, Carol Johnson. Carol?
Thank you so much, Governor, and thank you again to Jim for hosting us. Ocean Mental Health is a key partner for us here in Ocean County, and it helps us with our work with agencies across the state. Again, it is really a pleasure to be here with you, and to Andy and Lauren, I just have to thank you so much for your grace in sharing your story. We'll all go home tonight and think about their stories, and they'll go home tonight and think about the next steps in their lives, and so it just takes so much courage, and so we're so grateful for you to do that. This table represents sort of the whole of government response the governor just talked about when it comes to our strategy to really tackling the opioid epidemic. And so Katie and I and the Department of Children and Families and Human Services work together on helping to get treatment to pregnant women and help ensure their children are safe as we direct treatment there. Marcus and Judy and I, so corrections in the health department, we're working to get medication-assisted treatment into county jails across the state. We have committed $8.8 million to be able to get treatment into county jails. You heard a little bit about Rob's Pathway program. I love this program. And this is what's so great about the fact that the governor's been able to commit new resources to the opioid epidemic in New Jersey is that we are focused on saving lives and getting people to treatment, but we're also laser focused on supporting people in recovery, because what matters is making sure that you have a pathway to recovery and can sustain that recovery, can get jobs, can get housing, and the like. And John, at the end of the table, is sort of a representation of the work we've been doing in Medicaid to try to think about how to encourage more community providers to do medication-assisted treatment. And so thinking about how we get it more accessible in communities. And John's organization has really been thinking about how to get medication-assisted treatment available when people are ready for it. And so we're grateful for everyone around the table and the legislative leaders who have helped support these efforts with us. But today I want to talk about a couple of new next steps in our work here. So first, as the governor mentioned, we're announcing a $1.67 million set of awards to 12 counties for what we're calling our County Innovation Awards to address the opioid epidemic. And this is the first round of these awards. We expect more counties will come online. But what we said to county leaders across the state was, tell us what your ideas are for local solutions that meet the needs in your community, and we will fund local initiatives if you hold a competitive process to really address those local needs in your community. And we've gotten some very exciting applications in for that process. We really think that this is an exciting way to kind of help meet local needs, and so we are very excited about that. I will tell you a little bit of the origin of this. We have been doing all of this work that we're talking about here methodically, working on prevention, treatment, and recovery strategies statewide. And then someone called in to ask the governor and said to the governor, I have this local project, how do I sustain my local project? And while we can't necessarily fund that local project, it caused our team to say, there are local solutions here. There are ways that we can be better supporting local avenues and innovations at the local level. And so our team quickly designed a local strategy to be able to get these grants out. And so we're really excited for the first step of that happening today. The second thing I want to announce today.
Sorry, is it Ocean County's getting $230,000? Did you say that already or not?
I did not say that already.
So Ocean County is getting $230,000. We'll take complete credit for this. Ocean County is one of the winners and is getting a grant award of $230,000 as part of this. Sorry.
That's correct. And so the second announcement we want to make, when we convened a few weeks ago, we talked about the fact that we were going to make Naloxone free, offer it for free to all police officers in the state, all police departments in the state. So today we're announcing that yesterday we shipped 53,000 doses of Naloxone to 424 police departments across the state. 19 departments here in Ocean County got 19,000 doses of Naloxone. Our goal is to get Naloxone into as many hands as possible. Naloxone, commonly called Narcan, is the life-saving overdose anecdote. Our goal is to get it into as many hands as possible because we need to save lives to get people connected to treatment. So today we are getting it into police departments across our state as part of our initiative. The second part of our Naloxone distribution is that we offered Naloxone to public libraries across the state. We know that libraries are trusted community spaces, and it's critical that, and so many librarians, the state library partnered with us on this to be sure that we were engaging librarians across the state, so we also distributed 400 doses to libraries today. And the final announcement that we're making today is the relaunch, the new refreshed launch of our Reach at 844 Reach NJ campaign. These signs around the room represent the posters and billboards and bus shelter signs that we will have across the state, really working to get information out about 844 Reach NJ, which is our 24/7 direct access to addiction counselors who can connect you to treatment across our state. We did a refresh on this campaign because we thought it was really important to listen to the voices of the individuals we're trying to reach with these messages. So we were able to do focus groups with individuals in recovery, with family members of individuals who have addiction. And so our campaign now reflects those voices, and we're really excited to be able to launch it. We also changed the way the calls come into us. You used to have to go through a host of prompts to get to us. When someone needs help, they need help. So we're doing now direct access to a live counselor as part of that service. And so our goal is to take down all the barriers to treatment, get people access to help when they need it. When someone's ready to raise their hand, we want to be there for them. Thank you.
Well done, Carol, on all the above. Wow. Great stuff. The clock is against us, so we'll do some very quick interventions here. Marcus, grab a mic if you could. Just give us a 30-second window as to what we're doing inside of the correction system that's different from what we have been doing before.
Sure. So again, so glad to be here. 30 seconds. So that's a lot to ask in 30 seconds.
Take all of 45.
45 seconds. Okay. So first of all, what we do in the Department of Corrections at the state level is that we understand that this requires a holistic approach. And so everyone that comes into our system at the state level gets assessed. Based upon that assessment, referrals take place. The long and short of it is that we're offering medication-assisted treatment, all forms of MAT in our state facilities, because we recognize that there's no one-size-fits-all approach. I think that's important. As far as the county level is concerned, and we also, Governor, have Warden Sandra Mueller from Ocean County here. I wanted to recognize her. She's been a great partner with us. We are working with our county facilities, as Carol said, to ensure that they have an MAT program that's sustainable. And so they're actually getting $400,000 award to help get their program off and running. One of the unique approaches about our program is this peer navigator solution. So I heard Lauren and Andy talk about recovery specialists and how important it is. So we actually have folks that are educating our folks on the inside about the services that we offer, but also working with them up to a year post-release as well. And we hope to see that, expand to our county facilities. So, we're trying to be innovative in our approach because we know that justice involved individuals they're struggling with this, but we think that we're on the right track and that we're working to become a national leader in fighting the opioid epidemic and correction. So,
thank you, Marcus. Rob, give us another minute. Amen. Give us another minute on pathways and other programs you've got in place to get folks back up on their feet.
Just real quick, thanks to your funding from last year, we put about $3.5 million on the street across the state to 6 counties: Atlantic, Camden, Essex, Middlesex, Monmouth, and Ocean. They weren't by accident. Those were the counties that we, through data, saw that were experiencing the worst of the epidemic. So far, in a little under a year, we've had 504 participants receiving coordinated case management, 172 of them entering into job training programs, 145 of them placed into employment, most importantly. And of those 145, 128 have been in their place of employment for 90-plus days already, which is an important data point. That's not to say the other ones that weren't in there had nothing to do with them. It could have been other job reasons. So we're looking to expand this going into the next year at other counties, and also more importantly, and Carol talked about the flexibility of her grants. Everything we do is trying to learn from what we're doing now to make sure it's more impactful going forward on the next round of these grants as well. And listen, in our department, especially we're almost full employment, we're dealing every day with barriers to employment for a lot of different reasons. And there's no doubt that recovery, addiction, and disorders are a big part of those barriers. We're doing everything we can in the department to help folks.
And we know Andy was very clear, articulate about this. The folks hold it against you, and we have to break the back of that.
Absolutely.
So thank you for that. I'm sort of randomly a little bit here, but Kim and John, from your perspectives, a lot of sneezing going on back there. I hope everyone's covering their mouth. Judy and I are on the edge of our seat here these days. You kind of in the category, if you had a magic wand, what are we not doing from your respective perspectives that we should be doing? Do you mind grabbing that, Mike?
Sure.
Or maybe we're doing something we need more of.
I think more access to services and in a way when people are ready is really where maybe one of the focuses could be. Medicaid transportation can be difficult sometimes. When folks are feeling ready to walk into treatment, it's not always easy to access Medicaid transportation right at that moment. So maybe looking into how to make that a service that's a little bit more amenable to be ready when people are ready would be something that would be helpful. I think that both departments have done a lot to increase access to services over time. Our partnership with Urgent Care Now has been an integral part of the success of the CCBHC at times because they're able to do Suboxone induction for us and help to make sure that people are feeling well and stable to begin treatment and then continue their MAT services here. Sure. So that's been invaluable. And I just want to also mention in terms of access, the opiate overdose task force that we sit on here in Ocean County, we notice the largest percentage of people who are passing away have connection to the justice system. Mm-hmm. And Warden Mueller has been wonderful in terms of welcoming us into the jail. We've had, we're there a number of times every week. We've had about 40 referrals from the jail over the past couple of months, and we have an 86% success rate in terms of engaging them into treatment when they walk out because we're able to be there.
That's
so
huge.
It really is about having the services available when people need them.
So hats off to the warden, and I will say one of the frustrations that you and I, when we first met, talked about was whether or not how we could take best practices at the state level into the county systems, and so Ocean County deserves a huge shout out for that. John, you grab a quick mic there if you don't mind. Just either what should we be doing more of, or what are we not doing that we should be doing?
A couple things. I'll reiterate what Kim had been saying about the transportation issues. This has come up at our Community Health Improvement Plan meetings through the Health Department here in Ocean County. It's come up, I have to give a shout out to WellCare, which is one of the managed Medicaid providers in the state, and we're engaged with them, and they have the same issues. Transportation is one of the key issues in terms of getting people to intensive outpatient treatment and getting them to MAT and other things, and it's just, that's not there in the current system. People suffering from substance use disorder are not considered permanently disabled. And it's one of those, we can't get them transportation. We're trying through volunteers, everything else, and it doesn't work. The other thing, I think everything that's going on is great, and there's a lot. It's a heavy lift overall. But whatever can be done to help decrease the stigma around behavioral health and especially substance use disorder. It's still there. It's there amongst the medical community, and it's one of those hidden things in our community because no one wants to talk about it and admit it. One of the big realizations for us in getting engaged with Ocean Mental Health and everything was our patients, the patients we're seeing day in, day out, they're the ones holding jobs and everything, and they're on Suboxone and recovering their lives or struggling with addiction issues at this point. And these are the people we're treating for sprained ankles and coughs, and hopefully not coronavirus. But you know, and that was just the realization we need to offer that to everyone. So, and I know I'll continue to work with Commissioner Johnson on advancing the idea of urgent care being a front point out there, an access point for MAT and other behavioral health issues in the state. So thank you.
Thank you for that. Mayor, can I ask you, how big a burden is this for you in Berkeley Township, or how big a challenge? Do you mind grabbing?
Yeah, it's a challenge, and you know, we're fortunate enough to have Ocean County Prosecutor Brad Billheimer. Actually, he's a Berkeley Township resident, so he works well with our police department in tackling this. In fact, he just last week announced the Blue Hope program, which anybody with an addiction problem would just report to a police department, no questions asked, and then they're referred to an agency like Ocean and Mental Health, and that's just been great in the battle against the opioid epidemic.
God bless you. That's great. Listen, it takes a village. We have $100 million in the current fiscal year budget directed at opioid programs, and I've given you the four broad prongs, and including the whole of government approach. We don't get that $100 million without the legislators standing along with us and supporting that. So first Sam and then John, your magic wand. By the way, we should be consulting you on coronavirus. It sounds like you've had more experience than the rest of us put together on global epidemics. But anything in the category of where you think we should be doing more, or what we should be doing that we're not doing yet at all? Do you mind grabbing the mic there, Sam?
I think that's been pretty well laid out by the previous speakers here, the things that we need to do. That we're making progress, but we've still got a long way to go. And it does take, as they say, a village, everybody working together to get there. We're making little progress, but we've got a long way to go and need to just make more commitments to keep it going.
Yep. This does feel like, in the football vernacular, every day is 3 yards off tackle. This is not a glamorous 40-yard pass endeavor. This is a grind, but God willing, grinding in the right direction. John, do you mind grabbing? Do you have a mic for that? Anything you see, you live this at so many levels. Thoughts you've got?
I think we have made progress. I think we are going in the right direction. In Atlantic County and throughout the state, recovery court is monumental in giving people a second chance. Extremely important. And with the bills that we had and with your signature, people who graduate recovery court in Atlantic County will now be able to get a key license in a casino. And the two young women here, main subject was being able to work and removing that stigma. This goes a long, long way in doing that.
Amen.
Very fortunate to have Judge Sampson, who is a champion with this, who night and day works on this, gives me the ability to go to drug court, recovery court, and listen in, trying to figure out how people get from A to B. I think that's very important. If we can figure out A, we'll come a long way. Yep. our legislators, both Senate and the Assembly, and your cooperation with the multitude of bills on this subject. Our labeling bill, March 1st, goes
Yep.
into effect. That product's already been sold, but if that parent is looking at that bottle every single day, they're giving their children opiates and looking at that red sticker.
Yep.
Hopefully, they won't renew it. Hopefully, they'll stop. Once again, it's a village.
Yep.
We have tremendous cooperation. We know what the goal is, and I think we're working for that.
Amen. Judy, anything you want to, thank you, John, for everything you do, not just for those remarks. Any quick
Sure.
thoughts from you?
Well, I just want to share with everyone that our first goal is harm reduction, and we have 7 harm reduction centers in New Jersey. We would love to have more. It's an opening, non-judgmental center where people walk in, they get tested for HIV, AIDS, STDs. They can get fentanyl strips to hopefully stem the burden of the overdose because of fentanyl. They also get connections to care, and 3,000 people walked through our doors last year, and 75% of them were brought to care, and a large percent of them have continued their treatment. We also have trained the first responders. It's called 5 Minutes to Help. When they give Narcan, to follow up at that vulnerable point in time to bring people to care and connect them to treatment centers. So when I say our goal is to prevent harm and to bring people to care, that's what we do every day, and it's what we try to do without stigma and with opening doors in a non-judgmental way.
Well said. And thank you for your leadership. By the way, Judy, like so many others that we're blessed to work with, as they say in baseball, is a 5-tool athlete. Judy led the 3-week commission that led to the flavored vaping ban that the bill that I've now signed is also, as I said earlier, leading our efforts on Corona and is a valuable, invaluable player in the opioids fight. Sharon, real quick, do you have a microphone handy? You got it? Give us a quick snapshot from the NJ Cares perspective on all this.
I think we're looking consistently for those opportunities when people will be ready. And one of those examples is the Operation Helping Hands, which initiated first in Bergen County when the AG was there as the prosecutor. We've now gotten it into all 21 counties with the assistance of the money through last year's budget. And we have other rounds contemplated going forward. This has proven to be very helpful in the round 2, which was a sub-grant from the Department of Health of Operation Helping Hands. 776 people either accepted treatment or recovery services at the point that they encountered law enforcement. And we think it's important for law enforcement to recognize their role in bringing people to the care that they need. That may be the moment that people see they're ready and they're willing to accept. So we're thankful for that continuation and looking for other points in which we can leverage and be there to offer assistance.
Well done, Sharon. Thank you for that. Katie and I were together yesterday trying to talk about, with a group, about a little bit what you went through, Lauren, with your daughter, to be as enlightened as we possibly can be as a state as it relates to the tough decisions that you had to sadly go through in terms of splitting a family and all the heartache that goes with it. But Katie, real quick, you're gonna take us home here. Any quick observations from your perspective in the department?
Yeah, I think at DCF, some of the things that we were able to launch through the opioid funding that are new, not just for New Jersey, but even nationally, include the use of supportive housing. We operate one of the largest supportive housing programs for child welfare-involved families in the country called Keeping Families Together. We're safely housing over 600 families, many of whom are wrestling with multiple social determinants of health, not just addiction, but homelessness, domestic violence, mental health challenges, et cetera. And the purpose of that is to try to, when we can do it, make sure that separating the parent and the child isn't one of the things that contributes to deepening the addiction. The other major program that we were able to launch is peer recovery support specialists. And through that program, we are able to have peer recovery coaches embedded in all of our local offices. We're in the process of expanding that statewide again, so that when people are able to begin to realize that they need some help, that we have somebody else who's been doing the hard work of recovery right there with them to walk alongside them in that journey. I think the point of all of that for us is around the access and the entry into treatment, but also recognizing how incredibly hard maintaining recovery is and how important relationships are to be able to do that hard work.
You know, we use the phrase, it takes a thank you. It takes a village, and look at this table, look at this room, look at the amount of different touch points, even within our administration, the whole of government approach you need for something like this. And I don't think there's really any other way. You can't just put it on health or human services or children and families or corrections or the Attorney General's office or in the legislature or at the local or county level. Or private practice providers, you got to be all in. It's and all of the above. So, Jim, I want to thank you and your team again for hosting us so graciously. A special shout out to Lauren and Andy in particular for their Scarlett and Ray Lee, bless them as well. And the courage that you two have exhibited, not just today but every day, is truly jaw-dropping. To the members of our administration, to the practitioners, to our esteemed elected officials, Mayor, Sam, John, to freeholders, Brad, thank you for coming out today, Warden, to each and every one of you here. Let's stay in this fight together. We are analyzing real time, by the way, you should know. I've already had a series of exchanges this morning, the January fatalities, trying to make sure we understand exactly what's going on. There was a huge turn in the road in the wrong direction when fentanyl came on the scene X number of years ago. So there's really an apples to oranges reality when you compare, say, 5 years ago to last year's numbers because of that reality. We want to make sure there are no other curveballs that are being thrown in those numbers, and we're tracking it. And again, I commit to you that the data drives our program. So if we see something in that data that suggests that we need to tweak or even more than tweak our approach, we will do it. That's our responsibility. God bless you all. Thank you all for having us.